There is something that happens inside the human body, quietly, without warning, without fanfare, that doctors have known about for decades, but that most ordinary people have never been told. And today that changes, because what you are about to hear could be the most important thing you listen to this year. Not because it is dramatic, not because it is meant to frighten you, but because it is true. And because the truth, when you finally understand it, has the power to save your life or the life of someone you love deeply. Imagine waking up on a Tuesday morning feeling perfectly fine. You make your coffee. You sit by the window. Maybe the light is coming through just the way you like it. You feel rested. You feel okay. Nothing feels wrong. Nothing feels out of place. You go about your day. Maybe you run an errand. Maybe you call a grandchild. Maybe you sit down to watch the evening news. And everything, by every measure, seems completely normal. But inside your body, something has already begun. A quiet, almost invisible warning is building. And your brain is sending signals, real biological measurable signals, that something is wrong. The tragedy is that most people don't know how to read them. Most people dismiss them. Most people say, "I'm fine, it'll pass," and they go to bed. And by morning, everything has changed. That is what this is about today. That quiet day before. That invisible buildup. That warning the body gives that almost nobody recognizes until it is far too late. A stroke is one of the most devastating medical events a human being can experience. It is the fifth leading cause of death in the United States. It is the number one cause of long-term adult disability in this country. And here is the part that will stay with you. Approximately 80% of strokes are preventable. 80%. That number should give you hope, not hopelessness. Because prevention begins with awareness. And awareness begins right now with you in this moment. Let's talk about what a stroke actually is, because when you understand what is happening inside your body, the warning signs stop being mysterious and start making perfect, undeniable sense. Your brain is the most energy-hungry organ in your entire body. It makes up roughly 2% of your body weight, but it consumes about 20% of all the oxygen your heart pumps through your blood. Every single second of every single day, your brain is receiving a continuous, uninterrupted river of blood carrying oxygen and nutrients. Fuel that keeps your thoughts alive, your memory sharp, your balance steady, your words clear, your vision focused. That river never stops. It cannot stop. Not even for a moment. Because the moment blood flow to any part of the brain is interrupted, even for just 4 to 6 minutes, brain cells begin to die. And brain cells, unlike many other cells in the body, do not grow back. A stroke happens when that river of blood is suddenly cut off. There are two main ways this can happen. The first is called an ischemic stroke, and it accounts for roughly 87% of all strokes. In this type, a blood clot, either formed in the brain or traveling there from another part of the body, blocks one of the blood vessels feeding the brain. The second type is called a hemorrhagic stroke, and it happens when a blood vessel in the brain actually ruptures and bleeds into the surrounding tissue. Both types are catastrophic, both happen fast. But both, and this is the critical part, often send warning signals in the hours and days before they occur. Those warning signals are what most people have never been taught to recognize. And that is the quiet tragedy. Not that the body doesn't speak, but that no one told us how to listen. Now, here is something that many people find both alarming and deeply hopeful at the same time. Scientists and neurologists have a name for the warning event that often precedes a major stroke. It is called a TIA, a transient ischemic attack. But in everyday language, it is sometimes called a mini stroke, and the word mini is dangerously misleading. There is nothing minor about a TIA. What a TA actually is a temporary blockage of blood flow to the brain. The blood flow is disrupted, just like in a full stroke, but it resolves on its own within minutes or sometimes hours, leaving no permanent damage. The person feels fine again. They may feel slightly confused for a moment, then clear. They may lose vision in one eye for 30 seconds, then it returns. They may slur a word, stumble slightly, feel a strange numbness in their hand, and then, just as quickly, it goes away. And because it goes away, Most people do nothing. They think, that was strange, but I feel fine now. They make dinner. They go to bed. They do not call their doctor. And that decision, that one quiet, understandable, completely human decision, is what leads to the catastrophe that follows. Because here is what medical research has discovered with absolute clarity: a TIA is not a near miss. A TIA is a final warning. Studies have shown that approximately 10 to 15% of people who experience a TIA will have a full stroke within the next 3 months. And within the first 48 hours after a TIA, that risk is the highest it will ever be: 2 days. That's the window. That's how narrow the margin is between a warning and a disaster. Think about that for a moment. Your body gave you a signal, a real biological, neurological signal. Your body was essentially saying, pay attention. Something is happening. Please listen to me. And in most cases, the person didn't listen. Not because they were careless or foolish, but because no one ever taught them what that signal looks and feels like. No one ever sat down with them and said, if this happens to you, even for 60 seconds, even if it completely goes away, even if you feel totally fine afterward, this is serious. This is urgent. This requires immediate attention. Well, today someone is telling you. Today, that changes. Let's talk about what those signals actually feel like in real life. Not in clinical textbook language, but in the language of real human experience. Because this is where awareness becomes life-saving. One of the most common warning signs, and one of the most frequently dismissed, is a sudden, temporary weakness or numbness on one side of the body. Not both sides, one side. It might feel like your left hand suddenly fell asleep, that familiar pins and needles sensation, but you didn't do anything to cause it. You weren't sitting on it. You weren't pressing against anything. It just happened, out of nowhere, and then faded. Or maybe one leg felt suddenly heavy, like it wasn't fully yours for a few seconds. Maybe your face felt strange on one side, a fleeting numbness around your cheek or mouth or eye. These sensations feel odd but not alarming. They feel like the kind of thing you'd mention to your spouse and then forget about by morning. But they are not forgettable. They are one of the clearest signals the brain can give that blood flow has been interrupted somewhere inside it. Another warning that gets dismissed is a sudden, brief episode of confusion. Not the normal forgetfulness of misplacing your keys. Something different. A moment where you look at something familiar and your mind goes briefly blank. Where you reach for a word you've known your whole life and it simply isn't there. Where you suddenly don't quite understand what someone is saying to you, even though you can hear them clearly. These moments are frightening when they happen, but they pass so quickly that people convince themselves they imagined it. They did not imagine it. Vision changes are another signal that millions of people overlook. A sudden blurring in one eye. A brief loss of vision, like a curtain drawing across part of your visual field. A sensation of double vision that lasts for seconds and then clears. These things sound dramatic when you list them in a medical pamphlet, but in real life, in the actual living of a day, they feel tiny. They feel like a moment of tiredness or eye strain. They feel like nothing. And because they feel like nothing, they go unreported. Then there is the speech. A sudden difficulty finding words. A moment where your speech sounds slightly slurred to you, even though no one else notices. A brief inability to form a sentence the way you meant to. These are among the most telling warning signs a brain can produce, and they are among the most emotionally destabilizing ones because they make a person feel embarrassed. They make a person want to hide what just happened rather than report it. They make a person say, I must be tired, or I need more water, or I was just distracted. And so the moment passes, and the window closes. There is also the headache, a sudden, intense, unusual headache that feels different from any headache you have ever had before. Doctors describe it as a thunderclap headache, a pain that arrives without buildup, fully formed, severe, unlike anything familiar. This particular kind of headache can signal a hemorrhagic stroke, bleeding in the brain, and it demands immediate, urgent attention. Not a glass of water and a lie down, a phone call, an ambulance. Right now, but here is what makes all of this so profoundly important to understand. These signs don't always arrive in a dramatic way. They don't always feel catastrophic. They often feel like almost nothing. They feel like a glitch. They feel like a Tuesday morning moment that you'll probably forget by lunch. And that gap between how serious they are and how minor they feel is exactly what costs people their lives, their independence, their ability to walk, speak, think, remember. You deserve to know this. Not because knowledge is frightening, but because knowledge is power. Because when you understand what your body is trying to say, you can answer it, you can act, you can protect yourself. And here is the thing that I want you to hold on to as we go deeper into this conversation. The very fact that these warning signs exist, that the body gives them, that they are real and recognizable and detectable, that is not a source of fear. That is a source of profound hope. Because hope that is informed by truth is the most powerful kind of hope there is. So now you know what the warning signs feel like in real life. You know what a TA is, and you know why those fleeting, easy to dismiss moments are anything but trivial. But here is where the conversation gets even more interesting. Because a stroke doesn't just announce itself through neurological symptoms alone. The body is far more complex and far more communicative than that. In the 24 to 48 hours before a major stroke, the entire system, the heart, the blood vessels, the inflammatory pathways, even the quality of your sleep the night before, can be quietly broadcasting a signal. And today, we are going to learn how to read that broadcast. Let's start with something that might surprise you: blood pressure. Most people know that high blood pressure, hypertension, is one of the most significant risk factors for stroke. It is, in fact, the single most modifiable risk factor for stroke in the world. But what most people don't know is how blood pressure behaves in the hours leading up to a stroke event. For many individuals, blood pressure spikes dramatically in the early morning hours, particularly between 3 and 7 in the morning, during the phase of sleep when your body is beginning to prepare itself for waking. This pattern, called a morning surge, is a known and well-documented phenomenon in cardiovascular medicine. And for people whose arteries are already narrowed, already stiffened, already carrying the burden of years of high blood pressure, this morning surge can be the final straw. The pressure inside the vessels becomes too much. A clot dislodges, a vessel gives way, and a stroke begins often before the person has even opened their eyes. This is why doctors who specialize in stroke medicine pay such close attention to morning readings. This is why if you have high blood pressure and you've been told by your doctor to monitor it at home, the morning reading, taken before you rise, before you've had coffee or begun your day, is one of the most important numbers you can track. Because that number, in the days before a stroke, often tells a story that nothing else will. Now let's talk about something called atrial fibrillation, or AFib. This is a heart rhythm disorder that affects approximately 2.7 million Americans, and it becomes dramatically more common after the age of 60. In AFib, the upper chambers of the heart, the atria, beat chaotically and out of sync with the lower chambers. Instead of a steady, rhythmic contraction that smoothly moves blood forward, the upper chambers quiver irregularly, and blood can pool and stagnate inside them. When blood pools and stagnates, it forms clots. And when those clots break free and travel up through the bloodstream to the brain, they cause strokes. In fact, people with untreated AFib are 5 times more likely to have a stroke than people without it. Here is what makes AFib so dangerous as a stroke precursor: it is often completely silent. Many people with AFib have no idea they have it. They feel no palpitations, no chest pain, no shortness of breath. Their heart is quivering chaotically inside them, and they feel, as far as they can tell, perfectly fine. But in the hours before a stroke linked to AFib, some people do notice something: a fluttering sensation in the chest, a feeling of the heart skipping a beat or beating just slightly irregularly, a brief sense of being lightheaded without any clear reason, a moment of unusual fatigue, not the fatigue of a busy day, but a deeper, heavier tiredness that arrives unexpectedly and sits in the body in a way that feels unfamiliar. These sensations are easy to chalk up to aging, to stress, to a poor night's sleep. But for someone with undiagnosed AFib, they can be the final alarm before a catastrophic event. If you have ever felt that fluttering in your chest, even once, even briefly, please tell your doctor. It is one of the most important pieces of information you can share. There are simple, non-invasive ways to detect AFib, including a standard EKG, a portable heart monitor that you wear for a few days, and even certain smartwatches that are now FDA approved to detect irregular heart rhythms. These tools exist, they are available, and they can catch something that, if left undetected and untreated, carries a profound and unnecessary risk. Now let's talk about inflammation, because this is where the science gets genuinely fascinating and where the connection between your daily life, your food, your sleep, your stress, your movement, and your stroke risk becomes crystal clear. Inflammation is one of the body's most fundamental defense mechanisms. When you cut your finger, inflammation rushes in to protect the wound, fight infection, and begin healing. That kind of inflammation is healthy. That kind of inflammation is your friend. But there is another kind of inflammation, a slow, smoldering, chronic, low-grade inflammation that lives deep in the tissues and the blood vessels. And this kind is very different. This kind is quietly devastating. It is the kind of inflammation that doesn't announce itself with heat or redness or pain. It simply burns slowly over years and decades inside the walls of your arteries. When the inner lining of an artery, called the endothelium, is chronically inflamed, it becomes damaged and rough. And on that rough, damaged surface, cholesterol and other substances begin to accumulate, forming what doctors call plaque. Over time, that plaque builds up, hardens, and narrows the artery from the inside. The channel through which blood must flow becomes smaller and smaller. The blood, under pressure, must push harder to get through. And eventually, that plaque can crack or rupture, triggering the body to send clotting factors to the site of the rupture. And those clots can block the artery entirely or break free and travel to the brain. This is the mechanism behind the majority of ischemic strokes. And chronic inflammation is the foundation on which this entire process is built. Here is the hopeful part of this story, because there is one. Chronic inflammation is not inevitable. It is not simply a consequence of getting older that you must accept and endure. It is profoundly and powerfully influenced by the choices you make every single day, the food on your plate, the quality of your sleep, the stress that sits in your body and whether you have tools to release it, the movement or the absence of it in your daily life. All of these things speak directly to the level of inflammation in your body, and all of them are within your power to change. Let's start with food, because food is where many people feel the most empowered to act. The scientific evidence linking diet to stroke risk is among the most robust in all of medicine. Diets high in ultra-processed foods, packaged snacks, fast food, processed meats, foods loaded with refined sugar and industrial seed oils, are consistently linked to higher levels of systemic inflammation, higher blood pressure, greater plaque formation, and significantly elevated stroke risk. Conversely, diets rich in vegetables, fruits, whole grains, legumes, nuts, olive oil, and fatty fish are among the most powerful anti-inflammatory patterns a human being can follow. The Mediterranean diet, in particular, has been studied extensively in the context of stroke prevention, and the findings are remarkable. In one landmark study, people at high cardiovascular risk who followed a Mediterranean diet had a 30% reduction in stroke risk compared to those who followed a standard low-fat diet. 30% from food alone. Think about what that means. Every meal you eat is either feeding inflammation or fighting it. Every bite is either adding to that slow smoldering burn inside your arteries or cooling it down. That is not meant to make eating feel anxious or complicated. It is meant to make it feel powerful. Because it is. Now let's talk about sleep. This is one of the most underappreciated pillars of stroke prevention. And the science around it in the last decade has been genuinely stunning. During deep sleep, particularly during the stage called slow wave sleep, the brain engages in a remarkable self-cleaning process. The glymphatic system, a network of channels around the brain's blood vessels, becomes highly active during deep sleep, and essentially flushes out metabolic waste products that have accumulated during the day. One of the substances it clears is beta amyloid, a protein that, when it accumulates, is associated with cognitive decline. But more relevant to stroke risk, poor sleep is directly and powerfully linked to elevated blood pressure, increased inflammatory markers, greater risk of AFib, and higher cortisol levels, all of which are independent risk factors for stroke. Multiple large studies have found that people who consistently sleep fewer than 6 hours per night have significantly higher stroke risk than those who sleep 7 to 8 hours. And people who experience poor sleep quality, frequent waking, light sleep, sleep disrupted by untreated sleep apnea, carry similar risks even if they are technically in bed for a sufficient number of hours. Sleep apnea, in particular, is a condition that dramatically increases stroke risk, and it is vastly underdiagnosed, especially in people over 60. If you snore loudly, if your partner has noticed you stop breathing during sleep, if you wake up feeling unrefreshed despite a full night in bed, if you feel drowsy during the day despite having slept, these are signals worth investigating. A sleep study can diagnose sleep apnea, and treatment is highly effective. And treating it reduces stroke risk in a meaningful, measurable way. And then there is stress. The connection between chronic psychological stress and stroke risk is real, biological, and deeply important. When you experience stress, when the body activates what is known as the fight or flight response, a cascade of hormones floods the system. Cortisol and adrenaline rise, the heart beats faster, blood pressure goes up, blood vessels constrict. The blood itself becomes more viscous and more prone to clotting. In a brief emergency, this response is protective. It is designed to save your life in a moment of acute danger. But when that response is chronically activated, when the stress is not a passing moment, but a persistent state, a background hum of worry, grief, loneliness, or anxiety that never fully releases, the body pays a very high price. The arteries bear the brunt of it. The inflammatory load rises. The blood pressure stays elevated. And the cumulative effect over months and years is a meaningfully elevated risk of cardiovascular events, including stroke. This is not about telling you to simply relax or think positive. That kind of advice is not only unhelpful, it is disrespectful to the real and legitimate difficulties that life brings. What it is about is recognizing that your emotional life and your physical health are not separate things. They are one thing. The mind and the body speak the same language. And practices that genuinely reduce the stress response, not escape from life's difficulties, but tools for moving through them with greater ease, have real, measurable biological effects on stroke risk. Deep breathing, gentle movement, time in nature, connection with people you love. These are not luxuries, they are medicine. And speaking of movement, the role of physical activity in stroke prevention is so well established, so thoroughly documented across decades of research, that it is hard to overstate. Regular moderate physical activity, walking, swimming, gentle cycling, stretching, dancing, reduces blood pressure, reduces inflammation, improves the flexibility and health of blood vessel walls, supports healthy weight, improves sleep quality, reduces stress, and improves the efficiency with which the heart pumps blood. Every single one of those effects reduces stroke risk. And the beautiful thing is that you do not need to run marathons or lift heavy weights to experience these benefits. A 30-minute walk 5 days a week is enough to produce significant, measurable cardiovascular protection. Simple, attainable, and profoundly powerful. You have come a long way in this conversation. You have learned what is happening inside the body when a stroke begins to build. You have learned how to recognize the quiet, easy, to miss signals that the brain and body send in the hours and days before. You have learned what inflammation is doing to your arteries, why sleep matters more than most people realize, how stress writes itself into the biology of blood vessels, and how the choices you make at the dinner table are either protecting you or placing you at greater risk. All of that knowledge is real and it is yours to carry. But now we arrive at the most important part of this entire journey. Because knowing is only half the equation. The other half is acting, and in the case of stroke, the speed of your action, The willingness to take what you know seriously and respond immediately is the difference between a life fully lived and a life forever altered. Let's talk about the FAST acronym because it is one of the most important pieces of health literacy any person over 60 can possess, and it is genuinely life-saving when used correctly. FAST stands for face, arms, speech, and time. These four words encode the most critical and recognizable symptoms of a stroke in a form that is easy to remember even in a moment of panic or fear. Face has one side of the person's face suddenly drooped. If you ask them to smile, does their smile appear uneven or lopsided? Arms, if they raise both arms, does one arm drift downward involuntarily? Speech, is their speech suddenly slurred, strange, or impossible to understand? Are they having difficulty speaking at all, or are their words coming out confused and jumbled? And time, if you observe any one of these signs, even one, even briefly, even if the person insists they feel fine, time means you call 911 immediately. Not in a few minutes. Not after you see if it gets worse. Right now. The reason that immediacy matters so profoundly comes down to biology. When a stroke is ischemic, when it is caused by a clot blocking blood flow to the brain, there is a treatment that can be enormously effective at dissolving that clot and restoring blood flow. It is called TPA, tissue plasminogen activator, and it works by breaking down the clot from the inside, reopening the blocked artery, and allowing blood to flow back to the area of brain that has been deprived. But here is the critical and unyielding fact about TPA. It must be administered within 4.5 hours of the onset of symptoms to be effective. After that window closes, the treatment is no longer safe or beneficial. 4.5 hours. That is all. And that window begins not when you arrive at the hospital, not when you decide to call someone. It begins the moment the first symptoms appear. There is also a more recent and even more powerful treatment for certain strokes caused by large artery blockages. It is called mechanical thrombectomy, and it involves a neurovascular specialist threading a tiny catheter through a blood vessel all the way to the brain and physically removing the clot. The results of this procedure can be nothing short of extraordinary. People who arrived at the hospital barely able to move one side of their body have walked out days later. But this treatment, too, has a time window, up to 24 hours from the onset of symptoms in selected cases, though the sooner it is performed, the better the outcomes. And accessing it requires being at a comprehensive stroke center, which means getting to the emergency room fast enough to be evaluated, diagnosed, and transferred if necessary. Every single minute of delay in stroke treatment matters in a way that is not metaphorical, but deeply literal. Researchers have calculated that during a typical ischemic stroke, approximately 1.9 million brain neurons are lost every single minute that treatment is delayed. Every minute. 1.9 million cells. The phrase used in stroke medicine, time is brain, is not a slogan, it is a biological fact. The faster the response, the more brain is saved. The more brain is saved, the more function is preserved. The more function is preserved, the more fully that person can recover. And yet, study after study has found that most stroke patients wait too long before calling for help. They wait an average of several hours. They try to sleep it off. They call a family member first who tells them to wait and see. They drive themselves to urgent care instead of calling 911. They wonder if they are overreacting. They do not want to make a fuss. They do not want to be wrong. And in being cautious, in being polite, in being the kind of person who doesn't want to cause trouble, they lose the one thing they cannot afford to lose: time. So here is what I want you to remember with absolute clarity: you cannot overreact to a stroke symptom. You cannot be wrong by calling 911. You cannot be embarrassed by acting quickly. If you call 911 and it turns out to be something else, the paramedics will not be angry with you. Your family will not be frustrated with you. The emergency room staff will not judge you. They will be grateful that you came. They will evaluate you and find out what is happening. And if it was nothing serious, you will leave more informed and more reassured. But if it was the warning that it might have been, if those symptoms were the body's final alarm before a catastrophic event, then calling quickly, acting fast, refusing to wait and see, That choice becomes the reason you are still here. That choice becomes the thing that saves everything. Now let's talk about what you can do today, not in some abstract future, but in the next 24 hours, to meaningfully reduce your stroke risk and put yourself in the strongest possible position going forward. Because this is where awareness becomes action. And action, sustained over time, is the foundation of genuine health. The first thing, and this applies to everyone listening, regardless of how healthy you feel or how young your spirit is to know your numbers. Know your blood pressure. Know your blood sugar. Know your cholesterol levels. Know whether you are on any medications and whether you are taking them as prescribed. These numbers are not just statistics on a piece of paper. They are the vital signs of your cardiovascular system. They tell you where you stand and what work needs to be done. If you haven't had a checkup recently, make that appointment. If you have been avoiding it because you're afraid of what you might find out, I understand that completely. Fear is a very human response to uncertainty. But here is the truth: what you don't know cannot protect you. What you do know, you can act on. And action is always better than avoidance. The second thing is to talk to your doctor specifically about your stroke risk. Ask to be evaluated using a tool called the CACAS-2 VACE score if you have any history of irregular heartbeat or AFib. Ask whether your blood pressure is optimally controlled, not just acceptable, but truly optimal for your cardiovascular health. Ask whether you are at risk for sleep apnea and whether a sleep study might be appropriate. Ask about your medications, whether any of them affect blood pressure or clotting, and make sure your doctor has a complete picture of everything you take, including vitamins and supplements. This is your health. You are allowed to ask questions. You are allowed to advocate for yourself, and a good doctor will welcome these questions. The third thing, and this may be the most immediately actionable, is to tell the people in your life what you now know. Tell your spouse. Tell your adult children. Tell your closest friends. Share what you've learned about the fast signs, about TIAs, about the morning blood pressure surge, about the importance of calling 911 immediately rather than waiting. Because strokes often happen when you are alone, or when the person beside you doesn't know what they are seeing. The person who witnesses the symptoms and makes the call to 911 is very often not the person having the stroke. It is the person beside them. And if that person doesn't know what they are looking at, those precious minutes slip away. Knowledge shared is knowledge multiplied. Every person you tell today is someone who might save a life. Maybe yours, maybe someone they love. The fourth thing is to begin making, or continuing to make, those small daily investments in the lifestyle factors we talked about earlier. Not overhauling your entire life overnight. Not attempting dramatic, unsustainable changes that leave you exhausted and feeling like a failure. But small, meaningful, consistent choices that compound over time into profound protection. A walk most days. More vegetables and fruits on your plate. Less processed food, not none, just less. 7 to 8 hours of sleep as a genuine priority rather than an afterthought. A few minutes each day for something that genuinely calms your nervous system. Whatever that looks like for you, these things matter. They are not supplementary. They are foundational. They are the daily practice of protecting the brain and heart you depend on for everything. And through all of this, through every piece of information shared today, I want you to feel something beyond just awareness. I want you to feel something larger. Because this conversation was never really about fear. Fear is a starting point. Fear gets your attention. But fear is not where you want to live. Where you want to live is in the clarity that comes after fear. In the empowered understanding that the body you are living in is not a passive thing that things happen to. It is a dynamic, responsive, extraordinarily intelligent system that is always working on your behalf. It is sending you signals. It is asking you to listen. It is giving you warnings, giving you windows, giving you chances. And you, armed with what you now know, are finally in a position to hear what it has been trying to say. The day before a stroke is not inevitable. The catastrophe that so many people have suffered is not written in stone. The future is not fixed. There are people alive today who, because someone told them about TIAs, or because they recognized the fleeting numbness in their hand for what it was, went to the emergency room in time, received treatment in that narrow window, and are today walking with their grandchildren, reading books in the evening light, sitting at their kitchen table for Sunday dinner, doing all of the ordinary, irreplaceable things that make a life feel like a life. That is what is at stake in this knowledge. Not just the absence of a catastrophe, but the presence of all the ordinary beauty that a full and protected life makes possible. You have every reason to feel hopeful. You have every reason to feel capable. The knowledge you carry from this conversation is real, it is evidence-based, and it belongs to you now. Use it. Share it. Let it change how you listen to your body, how you care for it, how you show up for the people in your life who need you to still be here. Because you are needed. Your presence matters. Your health matters. And every choice you make from this day forward, every meal, every walk, every hour of good sleep, every time you take your blood pressure seriously, every time you recognize a warning sign and act on it without delay, is a choice for more life. More mornings, more light through the window, more coffee, more time. And that in the end is everything worth protecting.